Very nice to see all of you today. Really, really glad we could all be here for this great presentation, great speakers. I am Melissa Ferrari. Yes, like the car, no relation, unfortunately. So I'm a physician assistant. I work at the Scripps Clinic in gastroenterology. The two IBD specialists there are Dr. Gori Conagetti and Dr. Rebecca Matro. If any of you ever find yourself in San Diego, ever relocating, please do come and find us, and we'd be more than happy to help take care of you. All right, so I'd like to give a brief introduction for our panel. Not only do we have patients, but we also have caregivers. So I'd like to introduce first, we'll start with Jennifer.
Hi.
So Jennifer shared with us that she was diagnosed with ulcerative colitis when she was 17, but as very commonly, had symptoms for quite a while before that diagnosis was made, and that is very common. Sometimes it takes a while to really grasp of what's going on and to be able to establish before we can start getting you on your road to recovery. What I think is going to be really great about having you on this panel is that you then had to kind of traverse through high school and college and then having children, yes? So she'll be a great resource for us. Secondly, we have Priya, yes?
Yes.
Diagnosed pretty young too, right? At 16?
16, yes.
16, and I was reading you were sharing with us that it has been a rocky course. You have lots of treatments, steroids, complications from treatments you've been on, but then happy news, most recently within the last few weeks now in remission. So doing very, very well.
Yes.
Great.
According to my last colonoscopy 2 weeks ago.
Great. And then lastly, we have Margarita. Yes? What's great to have Margarita on our panel is that she's actually a mother who has a child with IBD, with ulcerative colitis, diagnosed when he was 4, which is heartbreaking. Unfortunately, we do know that the younger someone is diagnosed, the more aggressive that disease course tends to be. So unfortunately, did need a colectomy, but is now 7, yeah? And doing really well. So I think you're gonna have vast knowledge to be able to help us with this panel and connect with our audience today. All right, so where I usually like to start, since we've been hearing lots about IBD and actually just the tail ends of what we were just talking about in terms of mindfulness and mental health, is clearly when you were diagnosed with this or when you started to have to be involved in someone's care who has IBD, it changes your life. And it's a huge quality of life change in wrapping your mind around it and saying like, okay, this is where my life is going, but of course, there can be setbacks. So I was hoping that we could all just talk a little bit about some of those moments where it does get the better of you, and it can be very, very difficult, and kind of what that felt like for you, and choose maybe a moment to tell us how you were able to overcome that. Would anybody like to start?
I can start. Nothing like going first. So as she had mentioned, I was diagnosed when I was 17 years old, and so navigated, some really big milestones in my life. And it's been now almost 20 years, a little over 20 years actually. And when I think back, there wasn't a lot that was talked about when I was initially diagnosed when it comes to mental health. But that played a really big part of me healing. And for me, that really presented with a lot of anxiety. Anxiety about going certain places, anxiety about if I was going to be able to show up the way that I wanted to show up. What is the circumstances? Can I get out of the room quickly if I need to? It was so many of those kind of underlying factors, which has a real social implication. And I think the irony of me actually sitting here right now is I spent most of my, maybe 20s and early 30s really hiding the fact that I had this disease and making sure that nobody knew that I was ever sick. And so I think having that level of acceptance, but also sharing the story a little bit and making sure that the people around me realized what I was dealing with, especially in times when I couldn't show up and be my best that I thought I really, how I really wanted to be. So for me, that really showed up as anxiety, and I think, some of the things that was just talked about in the last talk have been really impactful for me, but just making sure that I got the tools and reached out and got that type of help, because there is a mental component to this as well. And so that was just something that helped me.
Go ahead.
Awesome. That was great. I can relate to a lot of what you said, Jennifer. The mental component for me has been equally, if not more challenging than just the physical symptoms of IBD. To give you a specific example, I was struggling with getting my colitis under control for a period of about 3 years. I had tried 2 biologics, I'd failed those, and put on a 3rd biologic within the span of about a year. And I just could not get relief from my symptoms. I had a major sense of despair and hopelessness. I was unemployed, living at home. There was absolutely nothing going on in my life except for my IBD and just trying to get that under control. Always at the doctor, flex cigs, colonoscopies, tests, MRIs, you name it. That was kind of what was consuming my life. So the despair and hopelessness was a major thing. I'd get my symptoms under control for a short period of time with the prednisone, and as soon as I started tapering, they'd all come rushing back. And that, it was very, very difficult to deal with mentally. And so I would also say that just having a strong support system really helped me get through some of those more challenging times. My mom has been amazing. She's my caregiver, and she's done so much for me. The other thing that really helped was getting more involved with the Crohn's and Colitis Foundation and meeting other patients. That's just been invaluable because patients, I found, really get it on a fundamental level. I could share my stories, just the physical symptoms as well as what I was going through emotionally, and just found an incredible source of support. So that's been really great.
Yeah, for us, it has also been very tough. He was diagnosed at 4, and a lot of the time when someone's diagnosed that early, the medication doesn't really work. And it also takes time to see if it will work, and throughout all that, he was in a lot of pain. It was difficult to do the blood work. It was difficult to do the colonoscopy. It was difficult when he was hospitalized. That was probably the hardest. But what helped me and him, mostly me, was the support group that I'm actually the facilitator for the Southern California Support Group for Parents, and it was really helpful for me to meet other parents who are going through the same thing, because it's hard to see your child be in pain, and there's no right answer, there's no simple treatment, there's no easy way out, and for him to deal with that psychologically at such a young age is very, very hard. But yeah, I think the support group was really important, and just spreading awareness to those around us, because not a lot of people know what IBD is. So just talking to his school and notifying his friends, and actually COVID was pretty good for us because he got to stay home. He didn't have to deal with the school. So he was having a lot of accidents during that year or 2, and so he could wear his diaper at home and not have to worry, and if anything happened, he was at home, he could just take a shower. So yeah, I think just getting support is really helpful.
And I want to drive that point home just a little bit more too. Even if we're talking about not an IBD perspective, I feel like in the last couple of years, maybe a decade, there really has been a greater push on mental health in general, and it's no longer taboo. And then you put chronic disease on top of that, and it just gets that much more difficult. And I'm glad that we have organizations like this where we can all get together and meet and talk about it and make it normal that it's okay to not be okay all the time, right? Okay. So going back to a little bit about what Dr. Ha was talking about and how it's important to realize how long it can take for a treatment to start, and that you need to kind of be in it, wait with it, do everything you can do in other aspects of your health. What did you guys find then from like maybe a diet perspective, right? Everyone's a little bit different, and there are some things that work for some that don't work for others. Were there any specific tips or tricks that just you found, this works for me and I definitely don't want to do this?
For my son, the diet didn't really work. We did try different things, because initially before diagnosis they were like, oh, why don't you cut out lactose, and why don't you cut out gluten, and and then it's like, okay, well, have you tried this diet or that diet? But it seemed like whatever we did, and I liked what the previous speaker, the dietitian, said, that you cannot cure it with diet if diet is not the cause. So it seemed like whatever we did, it didn't really, there wasn't a difference. His symptoms were just bad. And then when we did try the SCD diet, we only tried it for about a week, but I noticed that there wasn't any improvement during that week, which maybe isn't enough time, but I did notice that he was getting a little bit more depressed. And it's really hard for anyone to be on a diet, but especially at a young age. It's like a constant balance between his physical health and his mental health. And I want him to feel like a regular kid. You know, I want him to play with his friends, and I want him to eat whatever everyone else is eating and not have to worry about it. And when I restrict his diet and I notice that it's not even helping, you know, it just, you know, we do try to do healthy. I try to look at the ingredients, not too processed, but he's a little kid and he does like candy. I have noticed that is one thing that does make it worse, a lot of candy. So we do try to not do that. But overall, he pretty much just eats whatever he wants. There's a lot of rice and soy sauce. He likes that.
Stacy would agree with that, making sure you're not having such a restricted diet. And it sounds like it was poor for his mental health that way anyway.
I having ulcerative colitis now for over 20 years, when Stacy had said that, you know, all the different books and things that you can read online, I've probably done and tried all of them over the 20 years. But I think for me, diet, and I am one of those 90% who really believes that, you know, diet, or I guess lifestyle, I consider it more lifestyle, does play a role, and not necessarily in curing the disease by any means, but just being able to make sure that my body's healthy and that I'm in a place that, you know, I'm fueling my body in such a way that I feel is appropriate. And, you know, I did work with a dietitian and I did work with specialists, and, you know, it was a lot of trial and error, and it's not a short-term type of solution, but for me it was more about lifestyle and just ensuring that I'm supporting my body in a way that's, you know, going to be healthy for me. So
Yeah, similarly, I'd say I've tried probably every diet out there, and I used to be very restricted. I used to be really scared of, you know, nightshades, for example. I laughed when Stacy shared that. And I was clearly not getting the level of nutrition that I needed, especially during a flare. And so my more recent diet philosophy has been to eat just healthy, well-balanced meals. I definitely avoid processed foods, fried foods, you know, like candy, can't eat that anymore. And just kind of try to get my nutrients from like whole, real foods. I can't do as much dairy, but I do try to, you know, eat whatever I'm able to handle, and just cook as much as I can. And I think what Jennifer is saying about the lifestyle, that's been probably even more impactful, is finding ways to reduce stress, you know, breathing exercises, yoga. I've been trying to dabble a little bit more in that, and I've just found that those combined have played a much bigger role in making sure that I still stay well and feel well.
Thank you. I'm going to switch gears just a little bit. Something that's very important to me and when I manage my patients is practicing communication. I actually have lectured on the fact that sometimes, even though I'm sitting in the same room as you and we are talking about your symptoms, we're not communicating and I'm not getting from you what you're trying to tell me. And there have been entire studies about this to say, you know, you can give me your symptoms. So I have now employed the practice of, okay, so if I'm understanding you correctly, X, Y, and Z are the things that are most problematic for you right now, or X, Y, and Z is the biggest symptoms that you're having. And without doing that, unfortunately, sometimes we just don't meet. Have you ever had instances where you felt you really had to advocate for yourself because you didn't feel like maybe that communication was there for you? And kind of elaborate a little bit on that.
We've had that. Sometimes, there was one time when we went to the ER because he was in a lot of pain, and I asked him just to like make sure. I was like, well, do you want to go to the hospital? And he knows what that means. He knows there's going to be needles involved, and he doesn't like that. But he said, yes, I want to go. So to me, that indicates that it's something, you know, he's really in pain. So we went, and the doctor was kind of like, oh, you know, it's probably, as soon as they heard IBD or UC, they were like, okay, that's what it is. it's UC. He's in pain because of the UC. And the ER is just kind of trying to get rid of us, essentially. And they're like, just go to your GI, try to figure it out like that. And there's nothing we can do for you. But he was still in pain. And so I was like, I don't want to leave, because then we're just going to end up coming back. He's in pain, and I need you to figure out why. And eventually, one of the pediatricians there that was on call was like, well, let me check him for kidney stones. And it turned out it was kidney stones, which they didn't even, as soon as they heard UC, they were like, that must be the pain. But then as soon as they found out it was kidney stones, then it was quote unquote smooth sailing. They admitted him, they treated it, and after a few days we could leave the hospital. But that's one of the things is, if your instinct tells you that something is wrong, then you need to pursue it. And a lot of the time in my own care, I'll just be like, okay, whatever, I'll figure it out. But then when it comes to him, I am a lot more, now hold on, you need to treat it. And we're not leaving until you do. So definitely
Go
a lot
Mom.
more annoying.
Yeah, I don't have a specific example in mind, but I will say as an IBD patient, and I think most IBD patients are highly attuned to their bodies and their symptoms, and that can often be very hard to relay to your healthcare provider when it doesn't necessarily fit one of the textbook symptoms that are listed. It's obviously your bodies are very complex. IBD is very complex. And so I feel like, you kind of always have to advocate for yourself. I try to have a list of my symptoms and try to articulate exactly what's been going on and give them a timeline, and kind of, if for whatever reason there's a miscommunication, I try to speak up and really emphasize that, like, no, I can tell something's wrong. And I think it's this, it may not be that, but this is what my body is telling me. And so just really trying to communicate with as much information as possible and being prepared ahead of time with that before appointments has been helpful.
I love that. I'm going to second that. I love when patients come into me with lists of questions and things that have been going on, because if I can address them in that moment and get a better picture of a timeline of events, it actually helps me see how things are developing. So please do write everything down, keep a diary, even a calendar version of your symptoms when things are happening. So helpful. All right. Within IBD, clearly it changes your life. Lots of complications, potentially then good times too, right? When things finally start working. Have there been any experiences that you've had that you are thankful for that, maybe would not have happened in your life if you hadn't have gone down this journey?
I wouldn't say there's anything. I would do anything to remove all of my experiences that I've had if it could just go back to normal. But he is really strong. And I told him, I was like, every superhero has an origin story. And there's always something traumatic that happens to the superhero that then gets them to become the superhero that they were always meant to be. So, I hope that it'll build resilience in him, and he will be really, really strong later on as an adult and be able to handle pretty much anything that comes his way.
Before we all open up the questions to everyone, so we can also field questions from the audience, is there any one piece of advice that you feel in your specific circumstance that you would want to give to other patients?
What comes to mind for me is that, going back on to what Margarita just touched about, that level of resilience, is that, I've had to remind myself so many times that I am resilient. And, when you've been struggling, as Priya had mentioned, for sometimes years and trying multiple medications, and, my low point was I have 2 babies at home and I'm in the hospital and I can't take care of them. I had twin kids that I just brought home from the hospital themselves because I delivered a little bit early, and I couldn't be there because I was hospitalized with my IBD. And there's some of those moments that are so low, but it made me really appreciate the support system that I had around me to help me take care of my family and take care of myself. And I think that's one of the things is have a really strong support system, not just from your physician support system. I mean, I'm very grateful that I have a really good team that I can go to when I need it. And I think that's really important. But also that personal support system of people that you know are going to show up for you and that you know we're going to help pick you up. And Priya talked about her mom. My mom was there too with every hospitalization and with helping me at home, and my husband as well. And I think those are two things that I've become really grateful for. But it's also that resilience too, is that I am resilient. And a flare may be in my future again. I'm hoping not, but if it is, then I know that I have a really good team that's going to help me get back to where I need to be, and that's both my clinician team but also my personal team.
Resilience was on my mind as well. Both of you articulated that exactly what I was about to say, is just the amount of resilience that it's built in me. I don't necessarily know if I would have gotten that had I not been diagnosed with IBD. And to anyone who's been newly diagnosed, I would just tell them that you're not alone. There's a lot of us out there, and that despite this diagnosis, it's just one part of your life. It doesn't define your life, and you can still live well and thrive and, pursue your hopes and aspirations despite having this illness. So it's probably what I'd tell someone.
Thank you so much. Oh, go ahead. Did you have something?
Yeah, I wanted to add also, one advice is, I think it's really important that you have a good relationship with your physician and that you really trust him or her, and because there's no right answer. There's just multiple paths you can take, and especially when they're really little and it's not FDA approved and there's side effects and this and that. So it's really important that you trust what your physician has to say, and also I believe it's really important to get second and third opinions, just for your own state of mind, just to know that, okay, I did everything I could do, and this is where we're at. So yeah, those are my pieces of advice.
Thank you. We'd love to take some questions. Does anybody have anything you'd like to ask our panelists? Should I bring the microphone, or do you have another one? Okay.
You guys are excellent. It was awesome to hear you. I am a provider. I'm also the physician assistant at UCI. I have a question for Jennifer. And I ask this just because I have kind of a patient that's similar. What do you recommend? So I'm also a mom, and I think that when we become parents, it's one thing I don't know, and this is why I'm asking, is when you're kind of on your own and you're sick and you're going through that, but you're sick and now you have kids. Because the first thing is you need to keep this healthy, because I have kids. Like, it's not even about you. So as a provider, how can I have a patient who has 2 young kids at home, and she is just, it's hard. And she's now embarking on biologics and steroids and possible dual therapy and blah, 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 blah. So as a provider, what advice could you give me that I could give to her as a mother first and a patient second, to kind of handle that situation of being ill, the despair of being ill, and giving her hope that she'll get better? Yeah. I don't know if that's a valid question, but I think when you're a parent, it's a different chip, because you're really you're second. You're a mom always first, and you're a patient second. Yeah. How do I, as a provider, comfort her, help her, reassure her in that situation? Because I think it's really hard. And we have a lot of patients like it, right? Whether they're flaring or they're this, and they have kids at home. Yeah. And I think that that's a very important dynamic to address that parent side of a patient.
Yeah, I mean, it's a tough question, and I think it's so individual, just based on, anyone's particular circumstances. And it makes me emotional even just thinking about it, because it is really hard to show up for your kids. At the same time, for me, I didn't want them to see me sick. But I literally couldn't drive them to school because I couldn't make it to school and back. So, for me, it was, again, having that support system to know that, okay, I can show up for them at home as best I can, and I can pull it together while I'm here. But for things like getting them places that I can't get them to right now, or having, if there's something that somebody needed to be at or they needed to get somewhere, making sure I had that support system. So I think that was part of it. My kids were young when, I think they were 7 when I was rehospitalized and when I was at my worst in my life. And it was also about me just being really open and honest with them of like, look, mom's sick and I have to go to the hospital and I don't know when I'm coming back, but I'm going to be okay. And, having that communication with them and letting them see, like, I'm struggling right now, but I'm going to be okay, and you're going to help me get through this. And I think allowing my kids to see that too has also had, allowed them to develop some sort of resilience and some sort of empathy. Because you can't understand something. I mean, you can't empathize with somebody if you don't understand. And so for me, I was able to be that transparent with my kids. Now, that may not be the answer for everybody, but I think that's what really helped me get through it, is having that strong support system, showing up as best I can in whatever way I could, and then just forgiving myself, because I can't, there's some things I just physically couldn't do at that time, but also having that level of transparency with them so they knew where I was coming from.
That's a good answer. I'm thank you.
There's also a Facebook group. It's called IBD Moms. It's for moms who have IBD. I accidentally joined it one time.
Any more questions from?
I'm newly diagnosed as a senior with UC. My question is, when you're going through this flare, I'm going to be starting Remicade, but sleep deprivation. What do you do about that? I mean, you become an insomniac, and I take melatonin, different stuff but you are getting up like every hour and a half, where it just becomes. I haven't slept in months, a couple months now. So, and I haven't heard anyone speak to that, and that's got to affect your mental state as well. But how do you cope?
I just
With
want
all
to jump.
your years.
I just want to jump in, and I think all of these ladies would use that same word, and it's that resilience. Because you are going to start a treatment. Maybe it means you're going to be on steroids, and we know that these are just a means to an end. Steroids make sleep even worse. Everyone knows that. Insomniac, definitely, right? But we know this is just the course of the disease, and unfortunately, the urgency of those bowel movements throughout the night, many patients have that issue. I'm happy to hear you're going to be on a better treatment soon, and we can really hope that that's going to change that course. It's just using all of these other methods that we know to help you in the meantime, right? Like increasing like soluble fibers, and if you've already had your stool testing done and we know this isn't infectious, it's like using the antidiarrheals as you can use them, right, to try and increase the time between bowel movements. There aren't so many things we can do as we wait for treatments to start working, but it's just knowing that not alone, and that this is the really difficult point right now, but you have the support of your physician care team, you have the support of your family and other people in your life, and it will not be like this forever.
Hi, ladies. Thank you. So I'm actually here for my daughter, who's a pediatric IBD patient. And as of late, we've come into contact with some other kids who have C. diff in part to their IBD. And I was wondering, in your experience, is that something you're cautious of and would stay away from, hanging out with people with certain diseases that are contagious, like C. diff? Just wondering how you handle that for yourself and for your children.
My son did have recurring C. diff until he had his colectomy. Everybody was like really freaked out about the C. diff. They were like, you have to use this special Clorox, and it's, don't wash your hands and don't touch. I mean, I don't know. I didn't, he would still get it because it was kind of in his body and it would just come back. But I would just regularly clean, and as long as you wash your hands, because C. diff is, correct me if I'm wrong, but it's like if you ingest it through your mouth, right? So as long as you wash your hands and sanitize wherever the poo gets, you should be fine, right?
Correct. I'm not sure actually, can you clarify that question a little bit more? Was it that your daughter did get C. diff and now her friends were worried? I thought that was the other way around.
No, she doesn't have C. diff. She just hangs out with other IBD children who do, and I've heard that it is contagious, so I was just wondering if there's preventative measures, if that is something to even be concerned about.
I would say, in terms of any other kind of infectious disease, be a little bit more cautious. Once like the symptoms of that acute process are getting better and they've been on treatment, I would think it would proceed with caution. If your daughter is doing well, and we want to ensure like their mental health stays well too, right? Yeah, maybe a question for our medical panel later too.
Yeah, thank you.
Hi, I can relate to a lot of you up there. I was also diagnosed at 4 and just turned, the lovely age of 26, which is fun in the healthcare system. So wanted to ask your thoughts and input on navigating the healthcare system and insurance and all of that, being sick your whole life and just kind of coming into the time of making those decisions yourself.
Yeah, so the age of 26, I think that's when you transfer off your parents' insurance and onto your own. So I do remember that, and I was already diagnosed at the time too. So I think it's, again, just creating a really good team. I mean, luckily we're in an area where you have access to really good IBD specialists, and creating that team who can also help you navigate through insurance and navigate through ensuring that your medications do get covered. Because as we know, some of these medications are very expensive. Sometimes insurance companies will push back. And so, working with a team that can help ensure that you're getting the information that you need, and that the insurance company is getting the information that they need to approve some of the drugs, I think is really important. But we're in an area where thankfully we have really good access to a lot of good providers.
And I think it's also important when you have open enrollment that's one of the things you ask is my physician covered? Is my hospital covered? How much is a colonoscopy? How much is an MRI? What is the blood work? Is my medication covered? And if your GI is thinking, okay, we're going to do this medication, if that doesn't work, we're going to do that medication, check out both of those, make sure those are covered.
Yeah, and know what your out-of-pocket expenses are going to be prior to. Sometimes they could be pretty costly, but then at least you can plan ahead for some of those things.
And a lot of the biologic companies, they do have these coupons. So you only pay like $5 a month for the biologic. However, those do not apply to kids under 7 for some reason. So that's also something to keep in mind. And also make sure you always get major things pre-authorized, because then the hospital will say, oh, they're not covering it because they don't think it's necessary, which is ridiculous because these are kids that I'm dealing with, so obviously it's necessary if that's what we decided to do.
Thank you.
I was diagnosed with ulcerative colitis over 40 years ago, before I was a teenager. And as a teenager, I was very tormented. And I really don't talk about this with anybody other than my wife. And I'm just wondering, for the panel, how do you get comfortable talking about something? For me, it's been such a sense of a stigma that I've never been able to overcome.
Yeah, that's a really good question. I also struggled with that during maybe my first 9 years of diagnosis. And outside of my family and maybe just 1 or 2 close friends, I really didn't share a lot. And even with those friends, I would never get into the details of my symptoms. I will say that having a therapist has really helped me. It's someone you can just kind of unload everything on, and you don't have to worry about being judged. There's no stigma involved there. And that was a really good starting point. I was also through pure coincidence, I've had two therapists who've also had children who had IBD. And so it just felt like a very supportive environment. I could share everything I was feeling. And from there, it kind of branched out to, connecting with other patients, getting more involved in the foundation, and just realizing that it's a very supportive community. And that really helped me open up and, get to the point where I'm here today talking about it, which I couldn't have imagined, like 5 years ago.
And that's one of the things that's kind of good with when they're little is, the other kids in the class are like, oh, he just poos a lot. What are you going to do? And then he came back. I did a whole presentation for the school, so like all the teachers would be aware that he has this ileostomy. And he just kind of lifts his shirt up and he's like, yeah, this is my surgery. And then all the kids are like, okay. And that was it. So we're not there yet, so I am a little concerned, but so far he's doing pretty well.
What a great service you did for that entire generation of kids to be able to have done that presentation, that this is not going to be any kind of stigma for any of them, because as young kids, they're now very aware of even a big surgical procedure like that. That's so great.
I think that's all the questions, and we're also about our time, so parting words from the panel.
You got this.